There, this is Bethany Beasley doing the lower extremity venous protocol assessment video. I have a pretend transducer that I covered up here. Here's my indicator that I drew on it. Of course it's crooked because the paper keeps sliding off. But so we're going to start this lower extremity assessment, introducing ourselves to the patient, asking about patient history, signs, symptoms that they may have. Obviously, if we're doing a lower extremity exam, we're probably looking for a DVT of some kind. So when we start our exam, we're going to walk through the protocol here. You're going to start at the inguinal ligament, which is right here in the crease of the leg where it attaches. So you're going to start there. You're going to get the all the way down all of your images in transverse, and every 2 centimeters you're going to be doing compressions with your transducer to watch the vein collapse. So if it doesn't collapse, then obviously there's going to be some plaque in there somewhere because the blood flow is being, obstructed, and so that would give you a sign that there was there was something going on. And so every 2 centimeters you're going to be doing compressions all the way down the leg, and then you are going to turn your indicator in your sagittal plane, come all the way back up, do it all again in sagittal every 2 centimeters with your color flow this time and pulse wave Doppler. And then you're also going to do a Valsalva, a wiggle of the toes, or you're going to do a manual compressions that's distal to where your transducer is, and you're going to watch the augmentation on your waveform. Okay, so getting started right here, we're going to do it all in transverse first. So your indicator is going to be on your thumb side. I guess I should probably hold it where my thumb is. So thumb side, indicator, transverse. Starting in the inguinal ligament, you're going to get your common femoral vein, and then you're going to wiggle down, do your compressions, and then you're going to get your femoral, which is also going to run next to your femoral artery. So when you do your color flow in long, you're going to see both of those, and then trans, you're going to see both of those too. You're going to do your compressions all the way down, proximal, mid, distal. Then right here where you get to the knee, right here where you get to the knee, you're going to come to the back of the knee. This is going to be your popliteal. So you're going to do this proximal portion of your popliteal and then your distal portion of your popliteal. You're going to do compressions there. You're going to do compressions here. And then you're going to come this way and you head on down. You're going to see your smaller saphenous. Then you're going to do your posterior tibial and your perineal are going to be through the calf, and you're going to do compressions for all of that. And then when you get down here to the bottom of the leg, this is how we did it in our class. We came back up here and we did the greater saphenous vein, which you're going to see like Cleopatra's eye in between the fascia. So that'll be your greater saphenous. You're going to do that as much as you can with your compressions. And then you're going to come over here and you're going to do your anterior tibial. They're not going to be like super here, but your anterior tibial is going to be down, and you're going to try to do compressions there every 2 centimeters. So then you're going to go and you're going to turn into your sagittal plane. You're going to come back up the top. You're going to do it all the way back down. No compressions this time. So you're going to follow that common femoral into the femoral, and you're going to do color flow. And then you're going to do pulse wave. And when you do pulse wave, you're going to do your pulse wave, and then you're going to come down and you're going to do, hold that right there. Sorry, I'm holding the phone with the other hand. You're going to do a distal compression, so a manual compression like such, and let go. And then you're going to watch that on your waveform to check for that augmentation. Okay. And you're going to do that all the way down to the bottom of the leg, and that's what you're going to do. If you see any plaque in any of your transverse images or longitudinal images, or any of your distal compressions aren't working, or you're not collapsing anywhere around in here, so you're going to look for plaque in between you know, different places. When you're doing it in a sagittal and you're doing augmentation, if you have your transducer here, you hold that again, honey. Hold. You do your transducer here, and you do a distal compression here, and it doesn't augmentate like it's supposed to. In between here and your transducer is going to be something wrong. So you're going to want to go back and you're going to want to check it with your compressions and then see if you can find any plaque. If you do find any plaque, you're going to want to measure it. And you're going to measure it in trans, not in sagittal. So you're going to measure it in trans. You're going to measure your plaque, and then you're going to measure your true lumen from outer edge to outer edge. And then if you want to turn on it, you're going to do color flow Doppler there to check how the blood is flowing. And then you're going to do a pulse wave through that in the proximal, right in the middle of the plaque, and then distally to the plaque, and watch your waveform. And that is going to be your lower extremity venous exam.